Hello, my curious cat, and welcome back to another episode of the Psychology Podcast, the podcast for all the info on psychology's most questionable history. I'm your host, Leslie Lopez, PhD student and psychology nerd. So just like the last episode, we're going to be branching off of season 3 here. Season 3, we spent an entire episode learning about deep brain stimulation. Okay, to be fair, it wasn't just an entire episode on just deep brain stimulation. It was kind of like incorporated into our brain chip episode, but we did touch base on it. But anyways, similarly to last week, we're going to be learning about the life of the person behind deep brain stimulation, Dr. Robert Heath. You could say he was certainly a curious guy himself, to say the least, but he was a lot more than that, and not exactly in a good way. So, if you're a little bit insane in the membrane like me, get cozy tozy, and let's jump into it. So if you guys have been here long enough, you'll probably notice, or not, that I typically try to upload an episode like every 2 weeks or so, except this last episode was about like 4 weeks ago, a month to be exact. That's on me, okay? Like, I'm sorry. Life just kind of got away from me for a second there. Also, it was my birthday a couple weeks ago, and if you're like me, you're not exactly a fan of your birthday. Like, it's just one of those days where you just kind of dread. But that's just me. I know a lot of people out there are the same way. But anyways, okay, this isn't about me. This is about Dr. Robert Heath, and the important thing is we're alive, we're healthy, we're psyched. Let's get into it, all right? So, Dr. Heath, born May 9th, 1915, a Taurus. Speaking of Taurus, also guys, fun fact, okay, like I was raised the ultimate Taurus, okay? So I was born April 30th, a Taurus. I have a twin brother who, of course, is a Taurus. Both my parents were born mid-May, so both of them are Taurus. You could imagine, okay, like we had a lot of butting heads in that household growing up. And like everybody refused to move. Everybody refused to admit they were wrong. Stubborn bulls. I was raised that way. Taurus, raised by Taurus. You can probably imagine. Okay, but we're here for Dr. Heath, right? Okay, cool. So, Dr. Heath, growing up, Heath actually resented the idea of going into medicine because his dad was a doctor himself. He had a general practice, and that kind of made him just kind of like resent the idea of being a doctor himself. But either way, he went on to medical school, excelled. No surprise there. Halfway through his medical school career, his poor dad passed away and Heath took over his clinic. It wasn't long until Heath found out his calling in the medical field was actually neurology. So he wasn't interested in family practice like his dad was. So that kind of like got him confused, I guess. He was really into medicine, just not family practice. And he found his calling in neurology. We love that for him. Before he knew it, he was a board-certified neurologist studying psychiatry in Philly. Sadly, that didn't last long for him because World War II rolled around and he was drafted. Womp womp. But actually not so womp womp. Even though he was a board-certified neurologist, he still wasn't a psychiatrist just yet. But that didn't stop the Navy from drafting him as a chief psychiatrist at the U.S. Marine Hospital in New York City. This is because the need for psychiatrists was apparently much higher than the need for neurologists, and to them it was close enough. See, neurologists specialize in the nervous system, so like the spinal cord, the brainstem, etc. Well, they believe that if you can treat the nervous system, you can also treat nerves, as in mental disorders. Close enough, like I said, close enough. Well, at the time, they had a lot of soldiers suffering mentally and needed someone to help them out, right? This is truly where Dr. Heath found his true calling as a psychiatrist. After the war, Heath returned to New York as the senior psychiatrist of a new groundbreaking project at Columbia University. Snaps around for this Taurus. The project was called Columbia Greyston Project, and its primary goal was to find a safer, more effective neurological alternative to the lobotomy. They called this new procedure a tepectomy. We briefly covered the tepectomy in our season 3 episode on brain implants, but To reiterate, the tupectomy involved cutting out small portions from the frontal lobe. The main difference from the lobotomy was that they were smaller than those in your traditional lobotomy. The researchers definitely felt they found the ultimate cure for schizophrenia, depression, and OCD. But Heath, being the smart cookie that he is, was like, are we so sure about that? He thought the tupectomy was too close to the lobotomy, and in order to cure these mental disorders, there had to be a much deeper focus. Like the lobotomy was just too surface level work. Does that make sense? Eventually, he left the research team to pursue his own hypothesis. Honestly, love that for the fellow Taurus. My mama always taught me to never stay at a job or position that isn't bringing you joy. I'm telling you, I've quit small jobs on the spot for petty reasons, and I'm not afraid to admit it, okay? Like, if it doesn't bring me joy and the pay isn't worth it, because that's an important factor. If the pay isn't worth it, bye, deuces. So he said deuces, and he transferred over to Tulane University, where he was given total creative research freedom. It was at Tulane that he developed his research into various experiments regarding schizophrenia, including deep brain stimulation. But before deep brain stimulation, Heath had other hypotheses up his sleeve. Dr. Heath quickly shifted his research focus from finding a cure for schizophrenia to finding the cause of schizophrenia. You see the difference there? In 1955, Heath began investigating the pathological basis for schizophrenia using human subjects, which carried a huge controversy among his peers due to what the study consisted of. Heath injected 40 human volunteers with a serum that he'd extracted from patients with schizophrenia. And I say volunteers because the whole written consent thing was still a little sketchy back then. Heath claimed that the serum contained a new immunoglobulin that he had discovered called tarexin, and that it was the molecular basis for schizophrenia. A lot to take in there. So, injecting schizophrenia into healthy patients who don't have schizophrenia. That's definitely a new way to look at it. But I mean, hey, Heath claimed that these volunteers contracted symptoms associated with schizophrenia for about an hour after injection of the serum. Other scientists tried this method, but weren't as lucky as Heath in finding similar results. Shocker. I wonder why. After a while, Heath was like, you know what? Let me take another look at the cure because I'm not making much headway in researching the cause. He started looking at the emotional responses that come with schizophrenic symptoms. To spare the patient's emotions but also combat the negative emotional response seen in schizophrenia, he targeted the specific areas of the brain associated with the pleasure drive. These areas specifically being the Brodmann's areas 9 and 10 in the septal area. The only problem, how would he get to these specific brain areas? How can he tap into them? Thus, Heath's interest in electrical stimulation of deep cortical structures was born. This is what we know as deep brain stimulation today. Well, not today because it no longer exists, but you know what I mean. Deep brain stimulation consisted of inserting electrodes in the brain of schizophrenic patients. Sounds a bit like electroconvulsive therapy, except this was the early 1950s, so there were still a lot of bugs needed to have been tweaking, for sure. Heath conducted a total of 25 cases of electrical brain stimulation, which were performed primarily for the therapeutic benefit of patients diagnosed with schizophrenia. Keep in mind, this was the early 1950s, okay? So inserting electrodes into the brain was still a relatively new idea. Heck, it would be a relatively new idea today. So much so that they started performing these experiments without even knowing what they were doing, quite literally. There were a total of 25 cases, and the first 19 patients underwent open electrode placement, as in basically open brain surgery. The first 19 out of 25, but make that make sense. This method of Heath and his staff included making an incision through the cortex through the anterior horn of the lateral ventricle for a 3D view of the electrode placements. Sounds simple enough, right? But also, these electrical currents had a duration between 4 to 40 minutes. Then there were some patients who received up to 28 electrical shock sessions a day. Needless to say, electrode placement was highly inaccurate. This open technique of Heath's caused brain damage, and patients were prone to post-operative infections. Quite a lot of them, actually. Again, I cannot stress this enough. It was the 1950s, which also means that there were many doctors out there who were doing everything and anything that they can to be known as the hero of mental disorders, including Dr. Heath himself. For example, Heath claimed that 5 out of 20 of his patients showed marked improvement and 8 of 20 significant improvement. This, however, was a total lie. After a while, Heath realized that there was no significant improvement to his studies. In fact, quite the opposite. Of 20 of his patients, 2 developed brain abscess and died. 3 had seizures in the initial period of the experiment, and 2 others had seizures that went on for over 6 months into the experiment. There was also a record of patients having adverse reactions. For example, after stimulation, 1 patient expressed great fear, lashed out, and it took 5 nurses to restrain her. He did end his deep brain stimulation experiments after a few years, but he defended his work to the end. That is a total Taurus move. He knew it was wrong, but he stood by it through and refused to budge. In the end, his defense was that, quote, "The reality was that we were treating patients with sick minds who could be helped only by redirecting their minds towards health. So in other words, it wasn't about curing their mental illness, but rather redirecting their thoughts into a healthy mindset." Take that as you will. Heath quickly gained a reputation among his colleagues as someone who was fame hungry, not so much results hungry. He wasn't having it though. Of course. Heath essentially claimed that their hearts just weren't in it because they were too focused on the psychoanalytical portion of mental health and not the biological one. One of his peers commented saying, "My criticism of Heath was really that he didn't seem to know how to test his own conclusions for verification. He was always interested in results that were spectacular. He never tested the reliability of his findings, was very willing to rapidly publicize his findings, so he was quite unreliable," unquote. Again, take that as you will. Like, sheesh, as a researcher, being called unreliable is a huge slap in the face. Like, that's literally what you're supposed to be known for reliability. Like, that's what research is, right? But Dr. Heath refused to listen to the haters, as he should, because he's a Taurus, but also, like, he really should have kind of listened to their advice, because el que no oye consejo, no llega viejo. Heath went on his merry way and continued his experiments on schizophrenia cure. He even dabbled a bit into the use of psychedelics, and it's even speculated that he was hired by the CIA to take part in Project MK Ultra. Y'all remember that one? Now, speaking of psychedelics, but also kind of not, Heath had whole experiments where he trained monkeys to smoke marijuana to study its effects on the brain. Like, hello? He took 2 ruse macaques, trained them to smoke 1 blunt a day, 5 days a week for 6 months. He concluded that marijuana causes permanent changes in the brain. Nonetheless, he did support the decriminalization. King shit. In his study's conclusion, he stated, quote, "Alcohol is a simple drug with a temporary effect. Marijuana is complex with a persisting effect." Keep in mind though, okay, like Dr. Heath did have a reputation for being unreliable. So, now I know I've been saying things like king shit this whole time, but also he was very much an ass. So far, we've seen that he is the ultimate Taurus because he knows he's in the wrong, but also refuses to admit it. I can't really speak much on that because as a strong Taurus placement myself, sun and rising, okay, like I'm kind of the same way. Okay, but this isn't about me. This is about Dr. Heath. At least I'm stubborn, okay? Like I'm stubborn about things like who said what to who, not playing with people's physical and mental health. I'm just leave it at that, okay? But anyways, Heath was a pretty dangerous bull with all his experiments and attempts at curing, not treating. There's a big difference, okay? And I think that's where a lot of mad scientists go awry. But nothing beats Dr. Heath's treatment of what we know today as patient B19. By the late 1960s, Heath had significantly decreased the number of patients whom he was treating with deep brain stimulation. However, in 1972, he published what is probably his most controversial and likely most recognizable work. Like it's low-key what put him on the map, if we're being honest. There's many conflicting accounts about the events leading up to patient B19, mainly behind the patient's motivation for seeking treatment to begin with and Heath's reason for agreeing to the treatment. But now we don't want to victim blame. Obviously, of course, never. But also, do we really need to wonder why Heath agreed to treat him? I haven't even started explaining what patient B19 is about, but after what we've just learned about Dr. Heath, I think we can all come to the consensus that this man has no boundaries, yes? According to Heath, patient B19 had been hospitalized on multiple occasions after being diagnosed with depressive reaction. Subsequent diagnosis for patient B19 included personality disorder with homosexual behavior and drug experimentation that led to temporal lobe dysfunction. So, a depressed gay junkie. Heath would have loved modern day big cities after dark, if we're being honest. According to Heath, the patient requested treatment for homosexuality, although other accounts suggest that patient B19's treatment was court ordered following drug charges. Both very plausible options. Regardless, Heath attempted to use deep brain stimulation as a method to cure homosexuality as a form of conversion therapy. As a side quest, Heath sought to obtain EEG recordings of brain activity during an orgasm. You know what? That doesn't sound like the worst, like the latter, okay? Not the former. Oh my God, oh my God, oh my God. So please, let's picture this because this is exactly how it happened. Patient B19 had electrodes placed in various locations around the brain that were known to have pleasure stimulation. They were sent into a room with a button to press that sent electrical currents through the electrodes to these pleasure stimulation sites. They, as in patient B19, were then instructed to watch heterosexual porn and masturbate until they reached orgasm while repeatedly pressing the button, which remember, the button sent electrical currents through their brain pleasure areas. According to Heath, the goal of this little exercise was that the patient would become heterosexual after developing an association between women and the electrical stimulation of his pleasure site. That's pretty bad, but hold on. It gets worse. So after being forced to watch straight porn, which let's be honest, it's the worst kind, while sending electrical currents through their brain, patient B19 was subjected to forcefully have a 21-year-old, yes, age is important because barely fully legal, a 21-year-old female prostitute perform sexual acts with patient B19, aiming to finalize his newfound interest in heterosexuality. The sexual acts were performed with the electrodes in place while the patient's EEG recordings were monitored from the other room. Just imagine it for a sec. You have this beautiful, gorgeous worker on you while you're strapped to electrodes in your brain and you're not even enjoying it because you're gay. The long-term behavior of patient B19 is another point of contention. While Heath claimed that the patient had a full recovery from his homosexuality and engaged exclusively in heterosexual activities after the experiment, other sources argue that the patient continued to have homosexual relationships. It's not funny, but it's kind of funny. Okay. Not because of how unethical the whole thing was, obviously, but because of how they went through all that, which, by the way, they had to get a court-approved notice for the prostitute. That's why some people speculate like it was court-ordered, because they ended up... First of all, how did you get a court to approve on prostitution? The point is, the court allowed it, the court granted it, and Heath was allowed to do this experiment for nothing because they ended up with null results. Not even a year after this little conversion study on patient B19, Heath's ethical conduct was questioned in the U.S. Senate. The Senate got involved. That's how bad it was, you guys. Heath, being the Taurus that he is, defended his work, stating, quote, "We insist that all patients, as well as responsible family members, are thoroughly informed on the nature of the procedures and of every possible undesirable complication before forms are signed and the procedures are undertaken," unquote. Ooh, big word for Elmo. Of course, claiming informed consent. But not everyone bought his informed consent speech, claiming that a lot of witnesses came forward, claiming that he failed to discuss the risk of seizures or coma, which was quite common in Heath's experiments. Oy. He eventually retired in 1980 and then died in 1999 at the ripe age of 84. Well, my curious cats, thank you so much for tuning into today's episode. Dr. Robert Heath was quite the character for sure. Can't say his intentions were above his ethicality because I don't think I see any good intentions, if I'm being honest. I think he just wanted to be the hero and was willing to do anything to get that recognition. Or maybe I'm just like reading into it all wrong. What do I know, right? What do you guys think? Leave your comments below and let me know. Of course, if you enjoyed this episode, please remember to like, follow, subscribe on YouTube, Spotify, Instagram, and Apple Podcasts. As always, citations will be in the description if you want to check those out. Stay blessed, stay safe, and stay psyched. I love you. Bye.